Welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome back to the Consult Before the Cut.
We're back, baby.
Back in the saddle. I feel like we haven't filmed in a couple weeks. So I'm like,
Oh my
this
goodness.
is wild.
Apart.
It's been a whole year.
You've already broken stuff. Like, we just got back here. Before we get started, I wanted to thank Rejuvime Medical, your age-defying clinic, keeping us in our young, healthy, wonderful, youthful state with all things hormone replacement therapy, GLP-1s, peptide, that longevity medicine that's keeping us going with some aesthetic injectables as well. And then also we want to thank Weiler Plastic Surgery Group, Louisiana's largest plastic surgery group with 5 board certified plastic surgeons, many expert injectors, as well as estheticians to keep us looking beautiful, being the best version of us.
Yes. In
So,
2026.
In 2026. Can you believe it's 2026?
No.
Yesterday was 2019. Yesterday.
I know.
I know.
It's insane.
It does fly. The older you get, the quicker it goes.
Well, I'm young
It's- yeah,
at this
yeah, we're
table,
young.
so I'm young at this
Throw a
table.
few kids in there and it accelerates.
Correct.
It's
Yes.
crazy.
Correct.
Crazy.
Okay. Also, 'tis the season.
I know. I saw.
Yeah.
Tis
Mardi
the-
Gras here.
Yeah.
Tis
Yeah.
the
Well, it's not
season.
official though. 'Cause
When is-
12th night? It's 12. Is it 12 days?
January 6th.
Wait, what's
sorry.
the 12th
What are
night?
you? 12th night, it's
12
King's
Yeah,
Day.
King's
Yeah.
Day. King's
Yeah,
Day
yeah.
already
It's the start
happened.
of Carnival
Yeah.
season.
So
It's
off.
the Epiphany.
So off.
It's when the 3 wise men made it there
It was the
with
holy
their
day.
gifts.
It was the holy
It's
day.
King's Day.
Well, yesterday was Monday.
Monday.
Monday, yeah. Yeah.
Tuesday.
Monday.
Tuesday was the 6th.
You sure? We're dating ourselves here.
Oh my gosh.
She's right.
8th?
Okay.
Okay, yeah,
Oh my
You're right.
gosh. Tuesday
Okay.
was the 6th.
You're
I
right.
showed up here with a slew of king cakes
So
for
good.
everyone to have. Because
Okay,
it
what's
is-
your favorite king cake?
I don't know. I'm kind of all over the place.
I'm a
when it-
purist.
Are you?
I
Well,
am. I
I don't-
want a cinnamon.
I want cinnamon.
I like dong fong,
I do too.
but it's not in my mind a true king cake.
It's too much. It's the croissant as much as I mean.
Yeah.
It's amazing.
It's very
an
good.
amazing cake.
But it's a very you like when you open it up, you got about an hour to eat it, and
Mm-hmm.
then it just turns to mush.
So you're a Randazza.
Are you Randazzo's? Are you Haydell's?
I love Haydell's, and I love Randazzo's only from Slidell. The original lady, I think she was the wife.
Nona? Is it Nona?
No,
Randazzo?
Nona's is out of New Orleans, so
Is it?
Randazzo's is like a mega family. that
There's
split up.
there's like Manny, Nona.
I think it's the original wife. It was a brother team, I believe, right? I think. And I think the original wife or ex-wife restarted the bakery in Slidell. By far the best.
the best.
Haydell's is very good too.
Yeah. Okay. Have you ever had Maurice's in Metairie?
Maurice's is very good.
I love
Very good.
Maurice's in Metairie. That one
good.
is really.
Have
good.
you ever had poop hearts in Lafayette?
I've had poop
I
hearts in
freaking-
Lafayette.
they have it here in Baton Rouge. Now you can get. I go to
Oh, really?
So at
You
Calvin's
can get it
Market.
at Bedar.
Can you?
Yeah, you can get it at Bedar.
So they know
Calvin's?
me during
I didn't know that.
during king cake season. The guy that manages it at night knows me. He saves me every night. One king cake. I stop on the way home. I'll eat
Your
1 to 2 king
food
cakes a day.
relationships are like an issue. The Subway lady.
A true New Orleans
Subway
yeah,
lady
right
sticks
here.
extra cookies.
The Subway lady.
Oh, yeah.
The
Love it.
Calvin's Market. Like, I just
The,
can't. But do you know what? And I'm going to say it. I cannot stand. I think it's awful. And I'm probably going to be ridiculed for this. I hate Calandro's king cake.
Oh, yeah.
It's
Well,
too
now
mu-
Oak Point.
It's
right?
too much.
Yeah.
I
We
don't
got the
know if
Calandros
I-
on government.
Oh, you're right.
Yeah,
We still, but I don't like it. I don't like, and maybe it's just because I'm not a huge cream cheese
Yeah.
fan. I think that's where
Yeah.
that's where they
Too much
lose me
cream
on the
cheese,
king
yeah.
cake. It's like the too much cream cheese
I
because
agree.
I'm also a purist. I want cinnamon and I don't want anything.
Yeah.
I have a
I
St.
agree.
George mom that's like famous. Her
A
name
home,
is
a home king cake. Let me tell you something. I'm
Mata.
very judgmental of home king
Okay,
cakes.
so I'm gonna get you one. We're gonna see. I
I've
should
been
have brought
told-
king cake today. Shit.
I've been told many times. I always tell the story. So like, I don't like pecan pie either, right? So I went to this restaurant. It was famous.
How do you not like
I don't like
It was
pecan pie
famous
either.
in Jackson for pecan pie, right? And so comes to order dessert, and woman's like, you gonna order the pecan pie? And I'm like, no, I'm gonna get so and so. She's like, you have to get the pecan pie. I promise you,
I don't want it.
You would love it. It's world famous. You're gonna love it. I'm like, I don't like pecan pie. She's like, I'm gonna get it for you, and if you don't like it, I'm gonna have to pay for it.
I'm allergic to pecan.
Did you like it?
So she gives me the pecan pie. I take a bite. I push it to the side, and I'm like, I don't like pecan pie.
I don't.
She had
like
to pay
pecan
for it. I
pie.
refused to pay for it.
I cannot. Wait, what is it? Wait, I'm sorry. The squirrel that just happened here. We were like, home king cakes. I don't like pecan pie.
No, it's all dessert stuff, right?
Oh,
Sweets.
shoot.
Wait,
I have
so
a
who
horrible
is
sweet
the
tooth.
St. George that's, do we need to know about this?
Corinne Mata.
Okay. Is that what's called? How do you get them? Have to like secret code?
You have
to.
Wait, did I order this king cake on Instagram the other day?
Possibly. It's $45.
I did.
Okay.
Is it?
I
Okay.
did.
Let's
So
try it.
supposedly that is the viral
Oh, really?
king cake in this area. So I'll have to get one.
Matzo?
Is it really?
Is that what it's called? Matzo?
No,
Is that
it's
her name
called.
on it?
Look, let me pull up my messages. Where Corrito,
Yeah.
Corrito, Corrito,
Mata,
this-
Mata, right?
and that is her. Let's see, Corrito Mata, and
You're always on trend, Britt.
Yeah, of course she is.
I also
Especially food.
ordered,
You are like, you really should.
yeah, don't
You
come
should
here.
be living in like New Orleans, New York, like Miami.
I'd be so
foodie-
fat. Jesus Christ, I'd be so
foodie
fat.
quality.
A GLP-1 could not save me. But I did order. Josh and I looked at another one in New Orleans is from a bakery called Tartine.
I've been hearing about tartine.
So we ordered one.
Is that the guy he's on Instagram where you tell all the time with the axe? He was,
I don't
have
know.
you seen that guy? He's kind of.
I don't.
That
know.
is a trending one this
This
year.
is a
Everybody's
bakery.
talking about it.
This is a bakery in New Orleans, and you can do what's that Good Belly to where you can
Yeah.
like order stuff,
Oh,
and so
really?
we got that. I will say the John Besh one. What's the restaurant? Willow Jean. Willow Jean has a really good king cake. So does Sucre.
Sucrase is good.
Sucrase is
a little
good.
too dense for me, but it's good.
It's very. It always
Okay,
has
now
like a
that our
lemon
teeth
taste
are
to
going to
it.
be rotting out talking about all this king cake.
That's what it was like.
Perfect intro.
Don't get us started, obviously, on a king cake situation because it has to taste good with a cup of coffee.
That's
what
right.
I'm saying.
To eat a king cake, you need,
need
good
teeth.
teeth.
That's right.
And you need to
Right?
clean them.
And you need to clean them. Yeah, that's the problem with kids. Like brush your. They're always thinking of king cake. To brush them before you go to bed, right?
My children have eaten king cake every single morning this week. Okay, so what we are talking about today, the secret of the Hollywood smile.
Yeah.
So good.
Secret of the Hollywood smile. And I think smiles are just as important as any work that we're doing with plastics, any work that we're doing on HRT, because I think it has such a confidence associated with it. You know what I mean? Like either you're super confident in your smile or it's something that you hide.
I agree. You see it in
it's
kids
huge.
when they're younger. Kids' teeth are all kind of crooked and jacked up. They won't smile very much.
Yep.
You see it a lot, which is crazy. Like you'll watch TV and they'll have these guys that or women that start for a year or two and their teeth don't look great, and all of a sudden they show up 2 years later and it's like, bling,
Yeah.
super bright and white.
What's the Chip and Joanna Haynes? Chip and Joanna, something with an H. Something with an H. I don't know what it is. He got new teeth.
Yeah,
He
got
did?
some
He got new
conference.
teeth.
Yeah,
Okay, but I don't like that either.
Some of it's good,
I don't
some of it's
like
bad.
bam,
right,
He got new teeth.
right.
Dennis the Menace. I don't like
Right.
that.
Right.
Chiclet.
But I think
Chiclets.
it's hugely important for confidence. I
think
really
it
do.
is.
I think you don't realize how unconfident some people are when they're ashamed of their smile, right? And then I think the other thing is the aesthetic units of the face, Taylor, right? I mean, all you do all day long is mostly fillers and injectables and toxins to the face, and how important a smile is to complete the picture, right? How, and it's funny because like I'm obviously married, and me and my wife have a very different sort of definition of beauty. She'll be like, "Did you see how gorgeous that woman was?" And I'm like, "What?" Talking about? She's like, "Yeah. I mean, you see that? She had big, beautiful teeth, the smile, and the beautiful thick hair." And I'm like, "That's the last thing I was looking at."
It was like she
But-
had teeth.
She had teeth, yeah.
Right.
But I think it's very. I think women possibly notice it a little bit more than men.
Absolutely.
Right?
For
They're
sure.
big into teeth, but I think men, it completes that picture though, because men. I mean, teeth has a lot to do with lip volume and position of lips. Has to do a lot with the volume of the lower face, right? The
I also think
brightness
like
of
people
teeth.
with like big gums,
Yep.
like all that kind
Gummy
of stuff.
smiles
The gummy
and all that
smiles,
stuff,
what you're
right.
doing, to do that. But it all depends on what
And
your
on
teeth
your
look like.
realm, bone resorption. If
Yep.
you have, poor dentiscia, it affects your bone, which affects the support of the lower face and the jowling and the.
Yeah.
So we
Sunkenness.
just so happen to have an expert. I'm gonna introduce her.
I cannot wait for this.
May or may not have family.
Guys, we have talked about doing something like this since we started this podcast, and it has finally come to fruition.
This is our expert today is my little sister, right? So she is not only is she my little sister, but she's also a dentist by trade, right? And she has trained and really specializes and does a lot of cosmetic procedures. I'm going to toot her horn a little bit. So I went home for Christmas and I was thinking, my mom still has her paintings framed from when.
Oh, an artist?
Yeah, she was an artist. So I was sitting there thinking, I think Courtney, she's off camera right now, but she was sitting in a chair with her little girl, and there was a picture above her, and I'm like, where the hell did that come from? And it was like, I think it's like a series of angels or something. I'm like, I think she painted that when she was like 6 or 8, still framed in the house. So artistic by nature, and I'll let you guys talk about kids and all that, but she has her own practice with her and her husband, and really has gotten deep into cosmetic dentistry. And we go on trips with her and her husband, the kids, all the time, and we always end up discussing, because my wife is obsessed with teeth.
Yes.
So my wife is always pimping them and hitting them up for advice. She's too fearful to do anything yet. But
She's
she got the whole plan laid out.
But like, what if?
Over a couple of drinks, they usually lay out the plan every year, the same plan.
I love
and
it.
she never
I love
follows
that.
it.
Do you remember when we were when we had Shannon on the podcast?
Oh, yeah.
And remember I was like, oh my gosh, I was like, Shannon, I was like,
Yeah.
your smile. I was like, your smile is so beautiful.
Truly.
She's like, yeah, I bought that.
Yeah, I bought that. Yeah.
She's like, I bought this.
Yep.
And I was like,
Yeah.
oh, okay.
Yeah.
I was like, it's amazing.
Yeah.
But it completed
It
her
did.
journey. Yes, her journey.
It was amazing. I think
know.
teeth are so important. My daughter has absolutely mastered the soft smile where she doesn't show her teeth because like she's losing her teeth.
Yeah.
You know what I mean? And
Yeah.
she's just like, I'm always like, show me your teeth. And she's
Right.
like,
Right.
I'm like,
Yeah, because that confidence, you know,
Yeah.
it's hugely important.
she's like, I don't have teeth, Mom. Okay, so do you?
Yeah,
should
bring her in.
let's do it because we
Let's-
know nothing
Nothing.
about dentistry.
Nothing.
Like,
It's going to be an
just-
exciting conversation.
I
I
was
know
going to
that-
be a dentist. That's something random.
Really?
I was going to be a dentist before PA
Oh,
school.
yeah, you did work for, you worked for
Dr.
dentist for a while.
Cuvion, the best. And we did a full mouth extraction on
Yeah.
this sweet older man. And never again. After I saw that, I'm like, nope. So
that was it. That
Yep.
was like the.
that was the single moment. I'm like,
The full
I
mouth extraction
could
pushed you
not
over?
ever do this.
It's just too much, huh?
really.
So I can't wait to talk to her. It's exciting.
Oh, wow. Okay. So, with that being said, we are going to bring Dr. Weiler's little sister in here and we're going to ask her all the questions. And we're really excited. And y'all stay tuned. We'll be right back.
My name is Heather Robertson. I'm from Ponchatoula, Louisiana. I just recently turned 52, and I just didn't want to look like I turned 52. I have daughter-in-laws, I have daughters. We all go to the beach, and I just felt so uncomfortable, like in my bathing suit, because I had so much loose skin. Dr. Hogan and I talked about it. We did an arm lift on both of my arms. I'm so happy with the results. Don't hesitate. Step in and go for it, and just be a new you.
So my hair had started falling out about 8 months before I saw Holly at Rejuvime. I had seen my regular doctor and he told me everything was normal, but my hair was falling out, so I knew everything was not normal. When I went in to see Holly at Rejuvime, she gave me all the information that I needed and told me the benefits, how it would help. It's not brittle and frail anymore, and it looks much healthier. It's not just about what's going to happen today or tomorrow. It's about years forward.
Hey, everyone. Welcome back to the Consult Before the Cut. We have Courtney here with us.
Dr. Courtney
Yeah,
Whiteman.
Dr. Courtney-
My little sister.
Okay,
How many Weiler kids are there?
a lot. A brood.
How many
5.
Weiler kids are there?
5.
Are you the baby?
I'm the fourth.
You're the fourth.
I'm the fourth.
What are you?
Second oldest.
Second oldest.
Yep. So we have my older sister who is a chemistry teacher, is that right?
Yep.
And then myself. And then I have a younger brother who's a federal judge. And then I have Courtney is second to last, dentist. And then my little brother,
The baby.
the baby, is the anesthesiologist.
I mean,
Yeah. And then Courtney's married to a dentist.
okay.
Yes.
So do
Yeah.
you have to go to work with your husband every day?
We do, not every day.
How
but
you feel
But
about
y'all
that?
y'all don't work together though, right? Y'all
I was about to
different
say.
days.
We don't work together. You're right.
Okay. I was
Different
different
days. But he's pretty much in there. And we have 4 kids, so
Yeah.
someone's either dropping off or picking up the kids. And So we are we're not getting in the car together and driving together to work.
Yes.
I don't know if I could do that. I don't know if I could do that.
No.
So wait, do y'all still live in New Orleans?
We live in New Orleans.
They have a beautiful house on the lakefront. It's an
Oh,
awesome house
fun.
he's built. Yep.
Yeah, live in New Orleans.
They lived, didn't live there. Pete Fountain. You know who Pete Fountain is? Lived next to him. He was
No,
a
I
big.
don't know who Pete Fountain is. Who's Pete Fountain?
You don't know who Pete Fountain
I
is?
don't know
He's
who
like
Pete
a Mardi
Fountain
Gras legend. So,
Pete Fountain. Wait, is he the one that they all wear the same color
Yeah.
suits?
no.
Yeah, they wear the same color suits. Yeah.
That's the Blues Brothers, I think.
No, that's not. No. The parade when they all walk together in the
walk.
parade.
Yeah,
They all wear the
Half
same
walk.
color
Half
suits.
walk.
Yeah.
Yes.
That was him.
See?
So he's passed away.
Told you.
but
It
lived
took
next
me a
to
minute.
him.
I had to
Yep.
connect the.
I'm so impressed with you. Wow.
Very
I'm
good.
like, I knew. I was like, they all wear the same color
Yeah.
suits. It's the different colors. It's a different color suit that they wear each year that they walk in the parade
Yes.
for.
Yeah. But so we grew up in New Orleans.
Okay,
and-
what about Pete Fountain? Was
Well, they
there
lived next to
something
It was kind of famous. It's a long story. He was a big guy in New Orleans. He was like, I don't know.
It's like, where
It's a
were we
big Mardi
going
Gras
with
guy.
that?
He's a big Mardi Gras guy.
Yeah.
Courtney lives near him.
Oh,
okay.
okay.
Yes, he's my neighbor. He was my next door neighbor.
Here's your next door neighbor. Are
Your
you in
teeth are
Martin?
gorgeous.
Yes.
I keep
Do
staring.
you
My
eat king
gosh.
cake? I mean,
So I love king cake. Yes,
who's your king cake?
about the same that y'all had mentioned.
Yeah.
Randazzo, Nana Randazzo. This big. It's actually our dental practice is in St. Bernard Parish in Chalmette, and the Randazzo family I think
Yeah.
originated there. In Chalmette.
Nice. Oh, you and Chalmette.
Yeah.
Chalmette.
Yeah.
Chalmatians.
I mean, growing up, we probably ate at least a king cake a day in the house, right? And our mom is not.
y'all got
we were
18
not-
mouths to feed.
Yeah, we had a lot of food growing up, so we used to eat a lot of king cake, milk and king cake. It was like
That's so
literally
good.
like every day we had to do king cake. I think that's where
You love it.
I love it.
Yeah. I mean,
don't
it's
you feel that way? When we were
nostalgic.
growing up, we had a lot of king cake.
We did.
Yeah.
Too much king cake.
And you got 4 kids?
I have 4 kids.
You have
yes.
4 kids.
and they love king cake too.
They love
Yeah.
king cake too. I love that. I love it. Are you on them? Like, you better brush your teeth.
Oh yeah,
Oh,
every
yeah.
night. Every night.
They're hardcore about the dental stuff over there, and I'm kind of embarrassed because my teeth. My
Right.
sister has great teeth, and I have nice teeth. But I drink too much Diet Coke and coffee. I need to whiten them up.
I know. Okay. I want to talk about all the things.
Yeah.
Can
I
we-
know. I'm
Let's
like,
get
I
to
want
it.
dentist
Let's get
things.
started.
Okay.
Tell me first, history, dentist wise. So, where'd you go to dental school? How'd you end up where you're at first?
So I went to LSU undergrad and then LSU dental school. And we graduated in 2006. So going on 20 years now.
Wow.
This will be a 20-year anniversary. My husband and I got married our senior year of dental school. And we've been
Wow.
in St. Bernard ever since.
Nice.
For about 18,
And y'all came
20
out
years.
and opened that practice straight up, right?
We did about a
Worked it,
year.
right? Yeah,
about
y'all worked a little bit
Yeah, right.
around for some other people, but opened the practice very quickly.
Correct.
So,
And then it was
y'all
general.
been
It
in
is
business,
general.
the same business.
General dentistry.
General.
Yes.
Okay. General dentistry. And so the evolution through the years of just dentistry has is it like a big boom of the cosmetic side? How did that kind of integrate into your practice over?
Well, the first few years of work, I had 4 kids, so I worked part time. My husband mainly was running the practice, and about the last 10 years is when I've really been reinvigorated, curious about dentistry, and you want to add, cosmetic cases to your practice and really change people's lives. So that's where it's really kind of taken off for me.
Yeah. And then you get the bug, and you're like, oh my gosh, I'm making these people so happy.
Right.
Yes.
I mean, I guess
Yes.
it's so rewarding, just like what we do.
Right. Yeah, I mean, I think dentistry is, especially dentistry itself. Like, you don't even realize how much hands-on training. We have a little niece who's in dental school, and she's sort of struggling with the hand-eye coordination. Right. With you can describe it better, but I guess you got to burr down teeth
Right.
and all that. Right.
Right. Hand coordination. And oftentimes you're working in a mirror.
That's
upside
what
down.
Yeah.
That's just something that amazes me every time I go to the dentist. The way that they work in a mirror.
Yeah.
I can't imagine that.
That's a bit of a change.
Yeah.
That is wild to me how everything is done
Upside down.
Upside
upside down
yeah.
and backwards.
Yeah.
And backwards.
Like,
Right.
Yeah.
That's insane to me.
You need a good massage every 3 weeks.
It's a family thing. This is what I'm learning. Diet Coke massages, it's a family thing.
And kinky.
So coming back in, you said about 10 years ago, you kind of started getting back into it. I'm assuming the kids got a little bit older
Kids got a little bit older, yes.
and trying to get back into
Get
it.
back into
Do
it.
you feel the same way within plastics? Because I mean, plastics and aesthetics is kind of what we're familiar with, but do you find that confidence piece part of it? When you see your patients, when they come in the beginning, what that confidence changes over the journey as they're doing whatever it is that they're doing to improve their smile?
Totally, without a doubt. I mean, patients, you can do tiniest things and such dramatic results. It can be life changing. Or oftentimes patients come in pain.
Yeah.
You can alleviate pain for them, and that's rewarding as well.
Yeah.
Yeah.
See, I love that. And you think it's just a tiny little. It's like this little guy right here can change so much.
Right.
Like you're doing like a whole body.
Right.
You're doing a whole face.
Give me the history of cosmetic. So a long time ago, what were your options?
So, I mean, cosmetics really, I guess we could start talking about bleaching. Has been around
Right.
since the 80s, since 1980. And that's been, now you can go buy, if you're a young patient, you can buy bleaching strips at the local drugstore.
Right.
You know, something as simple as a teenager bleaching could be considered cosmetic. And there's different bleaching options that you can do in a professional setting as well.
What is your go-to if somebody comes in? Give us like hey, what's cheap and easy at home? What's your best advice? And then, hey, what's top tier professional? Does that make sense?
For whitening, you mean?
For whitening.
Yeah.
For the bleaching and the whitening, because I've got some darker teeth.
You need to go
Unfortunately.
in.
I know. I got a lot of stuff.
You're
I
not a
gotta do.
Walgreens patient.
I know. I did go in a few years ago. I got sensitive teeth though.
I know. Okay. I was going to say that.
So
The
talk to us
over the
about,
counter.
like, what's the best?
Make sure it's sensitive.
What's the best over the counter options, and then give us the professional options. To start with whitening.
So the over-the-counter options are really designed for the younger patient.
Okay.
The minimal staining on your teeth.
I mean, not the 53-year-old
Not
the
middle-aged
53-year-old.
man
Yeah.
who drinks too much
Diet
Diet Coke.
You would be great to have bleaching trays made, and you can bleach at your own convenience at home.
Okay.
You can get professional strength bleach from your dental provider. You either sleep in your trays at nighttime, or you wear them 1 hour a day.
Okay.
Can I put them in my retainer?
You could put them in your retainer. Yep.
Okay. So, like the Crest White Strips, option primarily for younger people, is what you're saying?
Primarily for younger people.
Okay.
Probably 21 and below, something like that.
21 and
Oh.
below.
Oh, really?
Okay.
Yeah.
You're not
All right.
supposed to be using those, Taylor.
But I have a tray, so like
Okay.
opalescence is what you're talking about,
Yep.
or something like that.
You can use it
You just put a
opalescence.
Okay.
squirt in your tray, wear your tray for an hour,
Correct.
but consistency. That's
Consistency, at least 2 weeks at a time, really, to see a result.
It's skincare for your teeth.
If
correct.
Exactly. If you are 50 or older, you have more gray to your teeth, more yellow hues
Yeah.
to your teeth, you're going to want to do a more advanced bleaching. You know, like we offer like an in-office
Yeah.
bleaching you can do. You can do something called a deep bleaching,
Okay.
which is really dramatic for people who've got deep staining, deep gray staining from nicotine.
That's in the office?
That is a combination of in the office and at home. That's
Okay.
deep bleaching.
Okay.
Some people have antibiotic staining on their teeth.
Yeah,
maybe
the
maybe
tetracycline. Yeah,
tetracycline.
Right.
And this deep bleaching has really changed the way you can treat these
Wow.
people.
Nice.
So you start in the office, and then you follow up with trays at home? Is that how you do it, kind of?
For the deeper bleaching, you're going to have the trays custom made. You're going to take those home and bleach for probably 6 to 8 weeks, and then come into the office and do a deep bleaching session. And maybe bleach
Is that
another
called
month.
like Zoom? What it was?
The name brand of that is Core. Core whitening.
Okay.
Yes. And
What-
that's dramatic.
What about
Wow.
the Zoom stuff that was big 10, 15? Is that off
is
the
it?
table?
That was the in office.
That's in office. We still do,
Oh, it
do
is?
that
Yeah.
as well.
And
Yeah.
is that the blue light thing?
Correct.
No, was
What
it?
was that? Was that
Blue
That's
light,
The blue
yeah.
light thing.
Right. You sit under our lights, an activator.
Yeah.
Zoom is a great option. Probably everybody here at this table could do Zoom. You're in
Okay.
there
Ooh,
1 hour.
okay.
You're
All
going to
right.
get 6
Who's
or 7
driving to New
shades later.
Orleans?
Get the bus ready.
No, but seriously, I feel like you would do that, or I would do that,
Yeah.
rather than bleaching every day. It's such a pain in
But
the
no,
butt.
you have to back it up with bleaching at home.
Oh,
though,
even
right?
Zoom, you do?
Well, no, Zoom can get you 6 to 7 shades lighter.
Yes.
But then as you drink your coffee or
Yeah.
your tea or something like that, you are going to want to touch up bleach.
Yeah.
Okay.
Okay.
Okay, you're gonna have to touch it up.
Maybe
You're
twice
gonna
a
have
year.
to touch it up. I drink coffee. You drink a lot of
Yeah.
coffee too,
Yes.
huh? Yeah.
What about those like TikTok products you see, the lights and all that stuff? Give you your thought on that.
So I don't quite know. You don't know where those products are
Right.
coming from.
Mm-hmm.
Yeah.
I don't know how you don't know how that light is working, or what is the concentration of the bleach. What type of bleach
Mm-hmm.
is it? I've had some people come into the office and they've had some burning on
Yeah.
their
Really?
gums and
Yeah.
sensitivity afterward and those types of things.
Wow.
Because
like
it's
people
being
ordering
made in a
Botox
garage.
and doing it at home. Yeah, it's crazy.
It's
You
just
see it all
being
the
made
time.
in a garage somewhere.
A big thing you want to be aware of is the whitening toothpaste. Sometimes they have a charcoal whitening toothpaste, and that toothpaste is too gritty. It's actually you're brushing away the enamel on your teeth.
Oh, wow.
Yeah.
I know you're not supposed to use that.
Do you know what it's called?
If it has charcoal labeled in it, or
okay.
even a whitening toothpaste, just be aware of that.
Okay.
If you've got a lot of dentistry in your mouth, maybe some porcelain in your mouth, or you've had some dental work done, you don't want to use an abrasive toothpaste. You want to use just a regular Colgate or Crest, or just your basic toothpaste.
Okay. Wow.
I use
didn't know that.
Colgate. I'm feeling really confident right now.
Do all right things.
I was like, I feel like I'm doing good. I have it's like Colgate, like Total Care or something like that. I feel like I'm doing all right.
Do you see a lot of patients with TMJ, gum recession from grinding, ruining their teeth,
Yes.
and treat
Yes.
the masseters?
Exactly. Yes, we do.
And do the, what do you call it, night guard or
You can
whatever?
there's a couple different options that you can do for those patients. I have spent, it's probably since 2019, I've gone to the Pankey Institute. It's an institute in Florida where you learn about TMD, how to care for those patients, comprehensive care, and those types of things. And I've learned to make a splint that's comfortable, and you can relieve a lot of facial pain for those patients.
These are those pain patients that you're
Pain
talking about
patients.
that are having that uncomfortability and pain. Just
I may have to send a patient to you. She is struggling so bad and now has ringing
Okay, tinnitus.
from I think the TMJ or TMD, like you said, that she cannot find anybody to help. And we're doing Botox in her masseters and her temporalis, and it's helping some, but it's so jacked up that it's causing ringing. So I was wondering about that.
Yeah, exactly. That can happen. There could be different reasons why you're clenching or grinding your teeth. You see it. It's more common in women. People who've had orthodontics.
Yeah.
It's really common in people who are taking an SSRI for anxiety. And some of those people do live in a lot of chronic pain. From that.
But I'm not hurting them, just treating them with
Not at all. No.
masseter Botox.
I do
Obviously,
masseter
they need a
Botox.
splint. But
I do
yeah.
masseter Botox or temporalis Botox, and that is dramatic pain
relief.
for
Yeah.
them.
Okay.
I mean, so many fun things.
I know. So good. I personally want to talk about like veneers.
How to get that beautiful smile?
Yeah, I was about to say.
That's a really
Do you want veneers?
Well, hold on.
Okay, sorry.
Let's walk through.
Okay.
Orthodontics? Do we start it on
whitening.
a
Okay,
whitening?
let's walk through. Let's not jump to
TMJ.
veneers yet.
Okay.
TMJ.
You will
so there's
find
some
there's lots of other
orthodontics.
options out there, Taylor, than grinding your teeth down and sticking veneers on there. Right? So,
We could do a whole mouth extraction. No.
okay,
Okay,
Taylor.
so like orthodontics.
well, we'll talk. All right.
Oh, I skipped one.
You did. Talk to us.
Bonding.
Bonding. Okay. Yeah.
What's
Talk to us
bonding?
about somebody comes in and they want to get that Hollywood smile, right?
Me. I'll do it. I just got out of Invisalign and I feel like I need braces again.
What are,
Okay,
give
but
us-
like
what are the
you
steps?
tell me what's a Hollywood smile.
I think that. So I think my sister has a
I think
Yes,
smile.
you do.
A
You got
beautiful smile.
great
There you
smile.
go. Look at
You
that
really
smile. I think
I'm
like
envy.
big, beautiful white teeth that look natural.
Yeah.
That aren't like big
Chiclets.
You know, they don't
That aren't
look
the
like,
chiclets.
Yeah, they don't like giant. You know.
Yeah.
Like it looks like a giant upper plate or something stuck in there. You know. But I think, like you said, we had Shannon Johnson on, and you're like,
Oh,
wow,
Shannon's
those teeth,
smile
beautiful,
is
right?
amazing.
But I think when I talk to my sister, there's a lot of misconceptions that you have to jump all the way to veneers, right? And I think you
Okay.
would,
Exactly.
and I think you have to do some work to get there, or else you end up with a lot of dental problems down the road, right? So, you know, obviously, so whitening is very important, right? But if you come in, let's say you're your typical 25 to 40-year-old female, right, that wants to improve the overall appearance,
Right.
you know, and obviously be healthy. But walk us through, like, you know, I always say, you know, every ski vacation or like inevitably Elizabeth, my wife, ends up, you know, getting her dental routine to get there. She never does it, but my sister lays out
One day.
what she needs to
I
do.
got faith in
right?
her. One day she's gonna do it.
One day she's going to do it.
She's gonna do it.
But talk to us about that. What are the steps? How do you go?
What are the steps? Well, I guess first, how I would handle it in my practice is, do you frequent the dental practice? Do you get your teeth cleaned on a regular basis?
Right.
What is your hygiene like? Because that's so crucial. That's the foundation to support the teeth for the beautiful smile, right? So, and then we educate people on how important it is to take good care of your teeth. Brushing at least twice a day, flossing your teeth.
Right.
That's kind of the boring stuff to it.
Right. That's the boring stuff.
That's the boring stuff.
That's what you got to do, right?
But that's like skincare. Like
Right.
going back to
You
what
gotta
you
do
said.
it. Yeah, you gotta do
You
it.
got to brush your teeth twice a day. You got to
Yeah.
use some good stuff. You got to stay
Floss.
on it.
Yeah.
When's the
You
last
gotta
time
floss.
you flossed?
This morning.
Okay, are you a flosser?
I'm a flosser, and I use the electric toothbrush.
I have an electric toothbrush.
And I've got much better now. I do have to go see a dentist. I haven't seen a dentist in a while because
You haven't.
lives kind of far
I'm every
away,
6 months. Are you every 6 months?
Oh yeah,
I'm every
like
6
But
months.
I was
clockwork.
religious. Yeah.
I
mean-
make my appointment when I leave.
Yeah.
I'm like,
Yeah, I'm bad about that.
And I floss every night. I'm
I
scared.
do floss. I floss at least
I
a
do
couple
floss.
times a week.
issues.
I floss too.
All right, so we got
All right.
that down.
All right, so that's
Flossing,
what
they
we're
say
doing.
flossing can add 10 years to your life. So
It's
just
very
I believe it
important
because of
with
heart
long-
health too,
Yep.
right?
right, right.
Yes.
Inflammation.
Yeah, other huge things with longevity in terms of dental care. They're even saying longevity-wise, possibly every 3 months do a teeth cleaning, which is crazy for
Yeah.
longevity-wise. Yeah, so such gut health.
I'd be
and
so into
Wow.
that though, but I'd be so into that.
Yeah.
I love getting my teeth cleaned. Love it.
Okay, so that's the most basic. So
Yes. Now what are we doing?
prophylactic
basic.
cleanings, floss
Correct,
your teeth.
prophylactic cleanings. And then you come in and we'll do a series of 10 photographs. You really sit down with the patient and try and understand what do they want, what do they desire, what kind of smile. Because like you said, what is your Hollywood smile?
Right.
What is your Hollywood
Yeah.
smile? Everyone's got a different.
So you want
different
patient
idea.
goals, right? Like so, breast augmentation, very
Yeah.
simple. We
Yeah.
tell ladies bring your picture in because I don't know what good looks. It may be giant Dolly Parton.
Yeah.
It may be tiny,
New York boobies.
New York boobies,
Yeah.
right? So you want pictures a little bit too of them, and they want to tell you what they want, right?
Exactly what
Okay.
they want. We'll
Okay.
go over some photos and show some work that's been done,
Okay.
and then from there you can discuss different options from something as simple as bonding. Bonding is just tooth filling material, and today's bonding that's available is phenomenal. So just maybe you got a sharp edge here or there, you could just smooth a couple edges, add some bonding, whiten some teeth, and that can make a huge difference.
Yep.
Can you increase the size of your teeth with bonding?
You can.
The overall, all the teeth can be kind of, or just certain
Wait,
teeth.
so
do you
what
mean?
is
Explain.
it?
I
Is
think
that
the
bonding?
problem, like when I think of bonding, I think of like repairing a tooth, but like
That's-
you're talking about like cosmetic bonding, right?
Correct. You can do bonding just to repair a tooth, maybe a fractured tooth.
Mm-hmm.
A lot of kids come in with fractured teeth, and
Yeah,
you
okay.
fix
That's
it.
me.
You fix it. You can even do composite veneers. So it's a veneer that's not made out of porcelain, but it's made out of a bonding material.
So explain that a little bit more.
What
Can
is
you?
that?
So
Yeah.
that is a material that's applied in the office. What's beautiful about that material is you generally don't have to remove enamel.
Okay.
It just goes over. If you want bigger, longer, brighter teeth, you can go directly over the teeth themselves
Oh,
with that material.
really?
Is it
So
like
it's just an application over your tooth
Correct.
to add
like a prosthetic tooth?
Exactly. It's adhered to the tooth, polished, shaped well, and polished. Yeah, it looks beautiful.
My second son has I think he broke his front tooth in half from playing sports.
Okay.
And so that was his permanent tooth. And so they put something to make it look like he has a tooth. That's bonding.
Correct. That would be considered bonding.
And you cannot tell at all that it's a fake tooth.
Right.
Okay.
It's beautiful.
That's what I have bonding on half of my front tooth because of an accident that I was in. Not that.
Huh.
So like this one, it's just bonding.
So what's the bonding process like in the office? Does that
Yeah,
make
how
sense? Like, how does it work?
extensive?
So the bonding process it's usually pretty quick. It's done in one day.
Like the whole mouth?
You
Like
could do the whole mouth. You could do it in stages. Sometimes you can do the bonding to set up a whole mouth case, if that makes sense. If the patient can afford that care in a year, you could do some bonding and stretch it out a couple of years. It's done usually. You numb the patient, you clean the teeth, you etch the teeth, and you adhere the bonding to the teeth, and then you polish and shape the teeth.
So do you have to take down the tooth at all to get the bonding correct, or you just simply deciding where you want to add the
Like
bonding?
making the Play-Doh look perfect over the tooth.
Typically, making the Play-Doh look perfect over the teeth.
Yeah.
A lot of people, why are you doing bonding? You know, are your teeth shortened? Are your
Right.
teeth worn? Are they discolored?
Right.
And after you decide why are you doing it, then you look at a wax up, and you would look at you would have the end result in hand before you start preparing on the teeth. Does that make sense?
Yeah. This is the artistry.
You mean a wax up, so like you'll put like wax teeth on somebody, like kind of? I don't know.
No. Yeah.
Is that like to show them what? I don't know. Because like, all right, I always go back to breast
Okay,
aug.
seriously though.
Seriously,
how do
but
you
like,
wax?
because like when we do a breast aug, we put a bra on, you put some implants in or some rice socks, whatever, and it put your clothes on. Augies,
Yeah.
right?
Hashtag Augies.
Hashtag Augies. And you get a good example in your head. But like when you said like bonding the wax, do you sort of build it out of a very easily removable material to show them? Or?
No, I think that's just the shape. She's talking about like how you have to shape the bonding, right?
So you can actually do it both ways. You could do, if it's just one or two teeth, maybe you can do a mock-up in the patient's mouth right then and there. If it's an extensive amount of work that needs to be done in the patient's mouth, you can get it's called a wax up. You can work closely with a dental ceramist. And now we have digital ways. We take digital scans of your mouth. They do a ideal wax up of what would look good in your smile. And then you can literally do a trial smile, apply it in, take some photos. Patient can get up, walk around, and look at them.
Oh my goodness, I love this.
That's pretty cool.
I think we should all go to New Orleans.
That is amazing. So are you finding that you're doing more bonding, or is this just like baby steps? Like we're not in the full conversation yet.
No, it's I feel bonding is very conservative. It can be very rewarding to the patient.
Yeah.
And then when you talk about the age of the patient, right? If you're dealing with a 20-year-old or a 30-year-old, that lifespan of the teeth, I mean, what are they going to look like in their 60s and 70s? So bonding is very conservative, and it can be easily removed, easily repolished. If it chips or breaks, easily patched. So it's a great option, particularly for a younger patient.
Is it very durable, like lifespan? Like you can get bonding in your 30s, and obviously you need a little bit of maintenance, but have bonding for the rest of your life, or is that?
You can. It can be durable. I mean, obviously.
Like anything, it can fail.
Correct.
And you age.
Yeah.
Correct.
Right. Your teeth are going to fail, much less the bonding, I'm sure.
Right.
We're always trying to tell people that your dentistry is going to have to be redone at some point.
Right.
Yeah.
Right. If you can get 10, 15, 20 years, what is the tooth going to look like if the
Correct.
dentistry is taken off? So you always want to be very conservative. I always decide to be very conservative with treatment planning.
15. I redid mine after 15 years.
Your bonding?
There you go.
Okay.
Why?
looks
Because you
good.
could see it, or
It was just like it had almost like chipped, and so we redid it. This was while I was doing like Invisalign and all that kind of stuff and whatnot, and we redid it. But yeah, it was 12,
That's a good lifespan.
13, 12 years. 12. I think it was like 12 or 13 years.
So
pretty amazing.
do you feel
That's because
like
I take care of my teeth. Too.
almost? Do you feel like almost everybody can get that? Like, do you have people that come in and show you pictures and you're like, okay, that's too much for bonding. We have to take a more aggressive step, or can you, with bonding, with good artistic eye, kind of meet most people's expectations? Does that make sense? Is that your 80% of the time you're bonding?
Well, it depends on. It really depends on the case selection. You know, again, the shape of the teeth. How broken are the teeth? Some people neglect their teeth,
Right.
and they show up 10 years later, and
Right.
you have no option but porcelain
Okay.
to restore those teeth.
Okay. Take us to that option. So porcelain in your mind is veneers, is that right?
Porcelain would be a veneer.
Okay.
Yep. You can do full coverage crowns, which you'll see on all over the internet. Either veneers or crowns are done.
What's the
What is a full coverage crown?
Yeah, you
I
always-
think a crown, and I don't know why. Like I think of like feeling like silver. I don't know why.
Yeah, I think the same thing, like a silver hat, like a Mardi Gras crown or
Why?
something.
What? Okay.
What is a crown?
What is it? What is it? Would you say a full coverage crown?
A full coverage crown.
Full coverage crown.
FCC.
My,
Full coverage
That's a
crown.
dental
I
term.
don't know what this is.
A veneer is more of like if you think of a contact lens, right? It's just going to be applied on we call it the facial surface of your teeth, the surface that you look at when you smile and talk. A crown is something that's going to generally wrap around the entire tooth,
So,
Like a hat.
like a hat on your teeth. Yeah.
so a veneer is just the front.
A veneer is just the front.
Okay.
and you have to shave down the tooth.
It depends on what type of veneer you're doing.
Okay.
It depends on what are you trying to achieve with the dentistry, if that makes sense.
Okay.
Oftentimes, yes, you have
Yeah.
to shave the teeth down.
Okay.
Like in little like Dracula teeth.
You can't think about it because it gets.
Wait. Okay. So, Courtney, let me ask this question. So, in my mind, and I see it because I a lot of
Little
surgery.
boo boo
like,
teeth. I just thought like
What'd you say?
Yeah, a little boo boo.
boo boo teeth.
Emery's old. He doesn't know what a labubu is anymore. We're in the thick of these young children.
Little
The
boo
little
teeth.
boo boo. The little boo boo teeth.
Little chitlins. All right. So, like when I look in patients' mouths, sometimes like I think of like a cheap veneer as this thing that's like stuck on the front, and you look deeper, you can see this nasty tooth behind it. And then in other people, I think of veneers as like they grind down this tooth to this little stub,
that's what
and
I
they
think of.
slide this like a cup or a hat, and the little nub goes into the hat, and the hat goes all the way up to the gum. Is that a Full coverage crown?
That's what you would call a full coverage
Yes.
crown.
Okay, so that's an
Correct.
FCC. That's a full. That's my new name.
FCC.
FCC.
This is the FCC.
Full coverage
However,
crown.
what you're talking about, if you're looking behind the veneer and you're
Yeah.
seeing maybe a discolored tooth,
Yeah.
That could be maybe just the natural shade of the patient's tooth.
Yeah.
But that in essence can be a more conservative approach because it's conserving that back
The
portion
tooth.
of the enamel.
Yeah.
That's the strength of the tooth is the enamel.
Yeah, like when I think of like I've I see a lot of like when I think of bad dental work. Oh, sorry. I think of like this really kind of weird, bad looking veneer stuck on the front of the tooth, and you can like almost like if you just look a little bit up, you can see that bad tooth behind it. But that's a classic veneer, is what you're saying, right? Is a stuck on the front. That's what most people say are veneers.
Correct.
And then the full coverage crown is more of what I think of like expensive veneers where they're kind of capping, crowning
Yeah, is that
the whole
right?
thing. Is that
It's
right? Or
not
are we off on
necessarily-
that? 'Cause I think there's a lot of misconceptions.
It's not necessarily more expensive to do a full coverage crown.
It's not. Okay.
It's not. It's the same. It's actually more expensive probably to do a veneer.
Really?
It's more technique sensitive. The preparation of the tooth is different.
Okay.
The bonding, all of the steps are very different and are very technique sensitive.
Okay.
So veneers can pop off of people's teeth.
Right, I see that,
if they're
right.
not bonded in properly. That happens more. Then a full coverage crown will kind of stay on there, but maybe there's leakage
Yeah.
or there's
Yes.
a cavity underneath it. Does
Yeah.
that make sense?
Yeah.
Yes.
What is it? What type of care are you having to do for like the full coverage crowns? Is it just the same dental care as you would typically do, or like is there? I don't know. I think of you're saying it's porcelain, so you still take care of it just like your regular tooth.
Exactly. Still, you probably want to go to the dentist at least 3 or 4 times a year, more often.
Yeah.
If you have that kind of dentistry
Thank
in your
goodness
mouth.
I don't have any FCCs. in my mouth.
Give it time. Give it time. If you don't go to the dentist, you're gonna get FCCs. I feel like
What is it is so detailed. I know you keep saying that. Like it is amazing how precise how long does that take you if you were doing like a full upper veneer
A full upper veneer.
or
if
FCC, whatever.
I made that up, Taylor.
I know. But like seriously, like a full
It's gonna go viral.
here,
1,000%.
a long time.
Just your smile. Well, you would want to take your time. You'd want to do first the workup, like we were talking about. Do the smile, do the design, do the try-in. Make sure the patient likes everything. Then you bring the patient back to prepare them for the veneers. That can be about a 4 or 5 hour visit, something like that.
Wow.
Then you want to make the temporaries, and from there, the patient goes home with some temporary crowns in their mouth or temporary veneers, and you want to make sure that the patient is just really satisfied with that.
Yeah.
Because that's your trial run. If you're not happy with your temporaries, you're not gonna be happy with your final product.
Right. So when they're in their temporaries, the lab is making their permanents.
The lab can be making the permanents, or oftentimes I'll wait on the temporaries. Say you have to check speech,
Yeah.
check smile, check
Wow.
function,
Bite.
and
Wow.
then check the bite.
Like, is that like
Yeah.
Make sure
all
it's
that.
they're happy with it, and then from there you make you can duplicate your temporaries for your finals. If that makes sense.
So
Do
cool.
a lot of people just do the front and not like all of them?
Well, that can lead to bite issues, breakdown of
I
your
was
teeth.
just
that kind of
curious. Like,
things.
you think like
Yeah.
a lot of people have maybe taken like the cheaper way out and saying like, oh, I just want like the front, like not, not on the back because
Yeah.
you don't see them, but like.
A lot of people. You're talking just for veneers, or you're talking just removing back teeth.
No,
same for
just for veneers.
Okay.
Like what's moving back teeth? What's that?
Moving
that? Wait,
No,
where are we moving
removing.
to? That's not on here.
Removing, like extracting.
Oh,
extract.
removing.
Yeah.
Yes, some people say, "Well, you can't see it. I don't care. Let's
and you're
remove
like,
it."
no, you're losing your bone, darling.
Correct.
Oh,
I'm
my
sorry.
gosh.
Just get rid of it.
Oh, you'd
Yeah.
be surprised.
Ugh.
I think people pull teeth pretty regularly. Like,
Yeah.
Yes.
Like get that, like,
Yes.
because what's the next step beyond? So I'm not a dentist. But
Go back to bonding.
You got bonding. You got veneers.
We didn't even
You
talk
got-
about orthodontics.
You got full capping crowns, right? FCC.
cap and crown.
Full crown.
Full crown coverage.
Full crown coverage. All right. What about implants? Dental implants.
Okay.
Oh.
Is that ever cosmetic? Does that make sense? Ever done? Obviously, I know like you ain't got no teeth, you need teeth, kind of deal, right? But like, talk to us about that. Is that even in the realm of like?
And for cosmetic work?
Yeah,
Oh,
like if like a normal 53-year-old man comes in and I got all my teeth, like you don't ever say, "Hey, pull some of the teeth out and put
no. You never want to do that. Implants are a great option. However, your natural tooth is going to last much longer than your implant.
Yeah.
Really?
It's not a closed shut deal with an implant.
Even the
kinda like
ones
a
that are
knee
like
replacement.
drilled into the bone and anchored and all that stuff?
Yeah.
Really? I didn't know that.
Well, they require, you have to think about it. Why did that patient lose their teeth? How
Right.
was their home care?
Right.
Did they ever go to the dentist?
Do
Right.
they have a good bone to put the implant in? I
Right.
feel like that's the biggest thing.
So
Right.
that
Yeah.
periodontal disease, that gum disease,
Yeah.
can destroy that implant.
So that's more functional
Mm-hmm.
and rescue dentistry as opposed to like cosmetic stuff, correct? For the most part, right?
Correct.
I mean, you can get a good result with a full, I don't know what they call them, full set. Is what they call them these days?
Those all on X cases
Right.
and whatnot. Yeah.
Are you talking about the implants?
Yeah, the dental implants where they, you pull all your teeth out and you put those bone anchors
Wait,
in.
you put implants for every tooth?
There's different options what
Yeah.
you can do. What they were talking about was an all on 4 case, or it's 4 to 6 implants. It can be very aggressive.
But so you do an implant and you have a bridge and you do another implant?
Exactly. But what you have to do is remove around 12 to 20 millimeters of bone to make room for that prosthesis. So
Unbelievable.
that can be very dramatic. If it fails
Yeah.
and you're 55,
Yeah.
what do you
Yeah,
do?
Yeah.
Eat Jello.
You can't. Yeah.
A lot
I
of
mean,
Jell-O.
pudding. I was going to say pudding. Get really familiar with
Wow,
soup.
I did not.
Some figgy pudding?
I was like, I mean,
Wow.
That's crazy.
that just makes my teeth hurt.
Okay,
All right.
somebody who wants a little bit of help,
Well,
a little bit of.
let's bring up orthodontics real quick.
Oh,
'cause
I
that's-
got all my kids are going to be in
yeah.
braces.
Talk about how that plays into all this too. I know it's a broad question. But
Right. Well, a big, beautiful smile, straight smile,
Mm-hmm.
white smile is a good starting point, right? We offer Invisalign. That's great for adults.
I did that.
You just did Invisalign.
Mm-hmm.
I think you have a beautiful smile.
I don't know. I don't like it. I still don't like it.
I think you got a good smile.
I still don't
Yeah,
like
you
it.
got. I think you got good
Smile.
front teeth. You got good front teeth. You got good.
You have great teeth.
I just don't like it. They just did something. They did something to like my bottom tooth because like mine were kind of like clustered into like the front, so it was really just like a spreading out. But in doing that, they ended up like shaving one side of my tooth for everything to fit appropriately.
Very common. Yeah. Okay. You
But
didn't like it.
now I feel like it's too much. Now I feel like it's got and I don't like it.
You feel like it's too small.
No, I feel like it's open. Like I feel
Too
like
many
they,
gaps.
I feel like they gapped it by
Okay.
the shaving and everything. I don't like it.
Well, it's probably
Don't
gonna all
look at
settle
it.
in like
Don't
this.
look at it.
I have never in my life seen that on you.
That's because my big lips cover it up.
I mean, I think it's beautiful.
No, I mean
yeah,
I'm
it's
very
fine.
I'm a
Use
lot
a little
happier.
more size
Yeah.
laterally in your teeth.
Well, that's why I'm
Right.
like
Yeah.
look, all of us.
Well, honest here.
No, I'm like there's like and that's what like right here like I just don't feel like it was like straight enough or I don't know. But they said they told me why and like all this other I'm like whatever. I think it's better than what it was. I think I would want it to be different,
all right.
but that's just me.
But let me ask you. All right. So somebody comes in, you whiten their teeth, looking good. Do you talk about orthodontics after that? If they have pretty straight teeth, I mean, is there a place for cosmetic orthodontics at an older age? Does that
Cosmetic
make
That's what I was going to say.
Invisalign.
Are you talking
Right.
about like older? You're talking
Yeah, I'm
about
not
older,
talking about
not like your kids that need
teenagers
braces.
the teeth are all no.
This is just
that's
older.
a whole different. That's
Yeah.
like hey for life.
Yeah,
I'm talking
that's
about
just like-
a 30 to 40-year-old
when I went
woman
in there.
comes in and wants a prettier smile. Is there a place for orthodontics? Invisalign.
Invisalign. Yeah, without a doubt. I feel like Invisalign, typically that 30 to 40-year-old, maybe they had braces as a child
Right.
or a teenager, right?
Right.
And things have relapsed a bit.
Yep.
So that's an ideal candidate for clear liners. You can reposition teeth into a better ideal position and they'll function better. They'll look better. And then after that, if you want to do a little bit of cosmetic bonding or even a veneer here or there to close a space, or in the dental world we call it a dark triangle. That would be lack of gum papilla, something like that. Like as you rotate teeth, you can get a dark triangle. Yes.
She's got a dark triangle.
I know. That's why I'm
She's
going to New
identified.
Orleans. That's why I'm going to New Orleans. Okay?
We're
Dark
road tripping.
I think we should all go.
So you
We'll
like
just bring him.
Invisalign? I mean, that's what you
I like
recommend
Invisalign,
for
yes.
ortho. Yeah.
I've done it on myself. It's great.
Is
Yeah.
there a difference between? I know there's like Invisalign, Spark. I know there's like a few different. Is it? Are they all pretty much like the same?
All your clear aligners, yes, it's whatever works well in the dentist's hands. You know, Invisalign's got a good name, a good warranty. So, for instance, if you weren't happy with the position of a certain tooth, go back to your provider. They could do a couple other aligners. Invisalign would do that for you.
Yeah.
And you want to go with a big name company generally.
Right.
Yeah.
Right.
They used to have the home mailing, aligners you did at home. I think that's since been bankrupt.
Oh, really?
But
Okay.
yeah, that
It's
was
all
not
for the
ideal.
dentist now.
Yeah.
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 Which I think is
Yeah, appropriate.
No,
Good.
it's appropriate. And
Yeah.
once again, I just love going to get my teeth clean.
yeah. And then so getting them white, get them straight. Then it's more of like fine tuning size or
Correct.
And that's stuff
That's
that you can do with the
next.
bonding.
That's something you can do with bonding
Like-
or porcelain veneer or something
Or
like that.
that's it.
can you look at me?
Stop it.
Hopefully I don't have stuff in my teeth.
Focus in.
I have two tiny teeth and they drive me crazy. That
Yeah.
I could bond that.
laterals.
Yeah.
You could bond
see
that.
that?
Neat.
You could. I'd have to get a little closer look.
Okay.
Yeah. You
Yeah.
talking about your little incisors over there?
They're
Yeah.
so
I got a
tiny.
tiny one
And if I had
too.
two big teeth right there, it'd be like,
Yeah.
"Whoa."
Big, yeah.
Yeah.
Whiter too. But
Is there
Definitely.
enough space in there to add volume?
So sometimes you would. So what I would want to measure it out on a computer screen,
Yeah.
and you can look at the width to length ratio of those teeth, and you could either move teeth with Invisalign and make a little more space to make a wider looking tooth. Those laterals are that's usually the tooth that's going to be a smaller tooth.
okay.
With people, that's the anomaly.
So you would do Invisalign, maybe like spread it out a little bit, and then bond the teeth that are small, the
You could
two
do that.
teeth that are small,
exactly.
and whiten. New girl.
Yeah.
Yeah.
I do
Okay.
love how we use every episode as like, okay, look at this though. Okay, but like if you were to look at that,
I'm driving to
like,
Chalmette.
check it out.
Y'all, you guys always.
Okay.
All right.
All right.
One final let's end on this. So
All right.
give us some costs because people always want to know pricing. So
Okay.
talk to us about so professional whitening. What was that? What do you think that costs?
Roundabout.
Roundabout. Well,
Okay.
roughly.
Yeah, like Zoom whitening is around $450, $500. You come in, that's 1 hour whitening.
Okay.
The deep bleaching, if you have antibiotic staining on your teeth or really gray teeth, that can range from $1,500 to around $2,000.
Okay. And that's with the home trays and some stuff
The
like
home
that.
trays, yeah.
Okay.
That's kind of amazing.
It
Yeah.
is. Life-changing.
I mean,
That can be
that's-
life changing.
It's
Yeah.
cheaper than the laser y'all are offering.
I mean, that is amazing.
All right, and then bonding. Let's talk about bonding pricing.
Bonding.
Rough estimate. I know it's like everybody's so different. but-
Everyone's different. Yeah, it can range anywhere from probably $450 to $750 per tooth.
Okay.
To do bonding.
Okay. On average, how many teeth do you like? If you want to do like cosmetic, are you talking like 4 teeth, 6 teeth, 8 teeth? What do you think?
For cosmetic, you would probably do 4 to 8 teeth.
Okay.
A lot of times you look at the lower teeth as well. The lower
Yeah.
incisors
Yep.
can be
lower teeth are
worn.
important.
So you may do those as well,
Okay. So 4,000 to 6,000 possibly for some bonding, possibly.
possibly.
Are veneers more expensive or less expensive?
Veneers are going to be more expensive.
They are.
They're going to be around $1,000 to $1,800, something like that per veneer.
Okay.
Probably the higher end, yeah.
And the full
Per tooth?
per tooth.
per tooth. Okay.
Wow.
You only get two. You only need two.
And then the crown, the
See?
FCC.
full
FCC.
coverage crown,
The FCC.
The FCC.
The crown can be similar cost to the veneer.
Okay.
Probably around $1,000 to maybe a little less, $1,000 to $1,500, something like that.
Okay.
Well, now I understand why people just do this.
Yeah. Just these four. Right
Okay.
here.
What other?
Maintenance.
Oh,
Yeah.
Invisalign. I wanted to know
Invisalign.
pricing
Yeah,
for
what is,
Invisalign.
what is Invisalign?
Invisalign can really be comparable to traditional braces, ortho. You're probably looking at, let's say, 4,000 to 7,000,
Yeah.
something like that, depending on the complexity of the case.
Yeah.
Sometimes you can do it as little as 3,500. Minor tooth movement,
Right.
but generally, yes.
And this is like a long answer, but give me a short answer. Why do all teenagers get braces and all adults seem to get Invisalign? Does that make sense?
I think
Is that wrong?
no. Well, but you're more
Compliance.
correct in that. Compliance.
Compliance?
Teenagers lose their Invisalign.
Right.
Right. They go to school. They take it out for lunch. They throw it away.
Yeah.
The braces are stuck in their on their
Yes.
teeth.
Right.
They ain't
So
going nowhere.
Ain't going
Yeah.
nowhere.
Their
That's
parents
good.
are
That's
paying for that, and they're
Right.
not.
And they ain't losing it.
Yeah.
That's good. Okay.
Yeah.
Good.
Invisalign is great because you could take it out and clean your teeth.
All right.
You could brush and floss. You don't have to worry about the brackets and the wires.
The
Yeah.
nasty staining in the brackets
Yeah.
can give you
Yeah.
too.
I want to talk about you. What do you do daily? What has been your like dental journey? What
Are those
Why
your
are your
teeth?
teeth so amazing? Your teeth are
Are these my teeth?
beautiful.
They are
These
your
are my
teeth.
teeth. They
They
are. My teeth.
are?
Great teeth.
Oh, thank you. Yes.
I know. I'm
Yeah,
like,
yeah,
are
yeah.
those your teeth?
So you've obviously whitened.
whitened. I had traditional braces in my 30s, and then I did some Invisalign about 5 years ago, just to tweak a couple things. I had my my bite balanced, meaning that it was adjusted to where it's comfortable and teeth aren't chipping and breaking down. And I brush at least twice a day, probably 3 times a day. Floss every night.
Your teeth are absolutely gorgeous.
How
You're
do you
gorgeous.
feel about
Thank you.
mouthwash?
Yeah, mouthwash. If you
Just out of curiosity.
That's a good question.
If
Yeah.
you have a dry mouth, whether it be from maybe medications or you're an older patient, 50 or older, you want to avoid alcohol in your mouthwash because it's going to dry your mouth out even more.
Oh, I thought you were just like, you want to avoid
I
alcohol.
thought you were telling Britt not to drink anymore.
Yeah, like-
that ain't happening.
Okay. No, so that's more for dry mouth. Like, that's more for dry mouth.
Right, like you know that mouthwash, you get that swish and that
Yeah.
burn feeling. That's the
Listerine
alcohol.
stuff. Avoid that.
Avoid that if you find you have a dry mouth.
Okay.
Yeah.
You know, you're going to use. I'm a big proponent of fluoride in your toothpaste.
Oh,
You can
yeah.
use an anti-cavity fluoride rinse at night.
For sure.
Yeah, 4 out of 5 dentists recommend fluoride.
4 out of 5. I don't know. I just think it's weird not to
Isn't that
have
the
fluoride.
tagline?
Yeah.
Yeah.
This is a 4 out of 5.
Well, somebody just took fluoride out of the water, right?
They tried to.
I tried to.
They
didn't
tried
have
to,
it.
yeah,
Okay.
in Louisiana.
Well, we did.
Louisiana. It was Louisiana. Of course they
Governor Landry was at it
It was
again.
like, no fluoride.
Governor Landry.
I'm like, oh, I'm here for the fluoride. No, absolutely.
All right, anything we need to know?
I know. What are
before?
we missing? This is
Well,
so fun.
She did mention this, and you stress this all the time. You talked about bite balance, and what did you say before? And the alignment.
Alignment, bite
I know
balance.
Dr. Whiteman's very big on that. We didn't get into that. We'll bring you
I
back
know.
for that.
I
that's
just
a
heard
whole
that
different
for you.
conversation. Right.
Right. I myself didn't have a very balanced bite and was struggling with a lot of headaches and facial pain, some masseter pain, some cracked teeth, that kind of thing.
Oh my
So
gosh.
you can a balanced bite is going to make you more comfortable. It's going to protect your teeth, and it can be done different ways. Whether it's done with orthodontics, Invisalign, or you can simply adjust someone's bite to make it more comfortable. It's like
it's
somebody
all
used the comparison of a door hinge. You know,
Yeah.
if you're trying to slam a door shut and because of the hinge doesn't fit correctly, you're going to damage the door frame, which will damage your teeth. So you want to protect your teeth and that's what we do when you come into the dental office. We look at your bite, we look at your gums, and we look at your teeth.
Huh. Wow.
so good.
So good.
I think we should all go to the dentist.
Together.
You need to. I
really
can't
need to go.
believe you. I can't.
Courtney lives too far away. It's my problem. So, although we do occasionally, we've ran our kids down there for emergency dental work on occasion. So I have to pat it out.
Yeah.
So yeah, it's good to have dentists in the family. So
I mean, I love the Lord's work that you're doing. I love to get my teeth clean.
well, wait, before we leave, plug yourself, Courtney. Where do you?
Yeah.
I know.
Yeah.
What's the name of the clinic?
Yeah,
All
come
right,
on.
we know
Come
you're
on.
in St. Bernard at Chalmette.
Yeah.
In St. Bernard, we're on Paris Road. It's Whiteman Family Dental. My husband and myself. I'm Courtney and my husband Mark.
Yep.
We've been there about 20 years, and we do all kinds of dentistry, general dentistry.
I
Yeah,
love
thank you
that.
guys for having me.
Everybody in the New Orleans area, go see Dr. Whiteman,
Yeah.
Dr. Whiteman, and get all your fun teeth stuff done.
That's right.
General dentistry, cosmetic dentistry, everything.
Teeth whitening.
Teeth
bonding.
whitening.
Hello.
Whitening, bonding, orthodontics, veneers, FCCs, anything like that. Thank you so much for coming today. Thanks so much for giving us all the insight on the
Yep.
teeth. This was super fun. Taylor and I are obviously, once again, we use these
Yes.
as our own
Consultations.
consultations. So we'll drag your brother down there so he can see a dentist as well. Everybody, make sure you're following us on all the podcast platforms, YouTube, subscribe below. Make sure we're doing that.
Subscribe.
Take a listen to us wherever it is that you listen to your podcast. We're on every platform. Follow us on social media. We are always
Yep.
loving to look at the followers
Yep.
and all that kind of stuff. It's crazy. It's crazy how much we've grown
fun.
in 2025.
Yeah.
It's wild. So wild. Remember to always stay curious, always stay informed, and remember to always consult before you cut. We'll see you guys next week. Have a good one.